Just a quick note here, I wanted to look at Hashimoto's thyroiditis, an autoimmune disease where there is a slow destruction of thyroid cells, resulting in inadequate thyroid hormone synthesis and release. Anyway, I wanted to just basically summarize this. Because it was the first autoimmune disease recognized, and it was first described by the Japanese specialist Hashimoto in Germany in 1912. It's very interesting. Anyway, Hashimoto thyroiditis is, or chronic lymphocytic thyroiditis, is an autoimmune disease in which the thyroid gland is attacked by a variety of cell and antibody-mediated immune processes. So talking about signs and symptoms here, this is very often results in hypothyroidism with bouts of hyperthyroidism. And the symptoms of Hashimoto's thyroiditis include weight gain, depression, mania, sensitivity to heat and cold, paresthesias, chronic fatigue, panic, bradycardia, tachycardia, congestive heart failure, high cholesterol, reactive hypoglycemia, constipation, migraines, muscle weakness, joint stiffness, cramps, memory loss, vision problems, infertility, and hair loss, among others. Probably very difficult to diagnose. If you want to talk about the diagnosis, it is made by detecting elevated levels of anti-thyroid peroxidase antibodies in the serum. And given the relatively non-specific symptoms of initial hypothyroidism, Hashimoto's thyroiditis is often misdiagnosed as depression or cyclothymia, or PMS or chronic fatigue syndrome, or fibromyalgia, and less frequently as ED or as an anxiety disorder. I'm just reading from Wikipedia here, but it says that on gross examination there is often presentation of a hard goiter that is not painful to the touch, and other symptoms seen with hypothyroidism such as preorbital myxedema depends on the current state of the progression of the response, especially given the usually gradual development of clinically relevant hypothyroidism. I'm going on a bit here, but this is so interesting, very important to learn about this. It says that for testing of thyroid stimulating hormone TSH, free T3 and free T4, and the antithyroglobulin antibodies, antithyroid peroxidase antibodies, and anti-microsomal antibodies can help obtain an accurate diagnosis. And early assessment of the patient may present with elevated levels of thyroglobulin owing to the transient thyroid toxicosis, as inflammation within the thyroid causes damage to the integrity of thyroid follicle storage of the thyroglobulin. TSH is increased as the pituitary tries to compensate for decreased T4. So there you have it, Hashimoto's thyroiditis, a quick summary.